I appreciate that the various reports that the two reports specifically that I'm going to mention have already been mentioned. And I'm going to zoom out a little bit from the details that Celine just provided and some of the research that was presented earlier, and zoom out as well from air quality that was mentioned first thing this morning. I know this is lung association, but health impacts in general are considerable stemming from climate change. So just very briefly what we are, Climate Atlantic is a fairly new hub established last June. Our role is to provide Atlantic Canadians with access to climate data, information, projections, and to help them in their decision-making process and adaptation process. And it sounds very, very broad, and it is indeed very broad. It's a very broad mandate that we have. Just in terms of what we do practically, this is a brief list: locating data, facilitating access to data, interpreting data and projections. We get requests for information. So where can I find sea level rise information? We jointly develop tools or adapt tools for regional and local use. We've got a website, climateatlantic.ca, sorry. And we are considered as the curator of information resources and tools that are out there. So we'll look at how viable they are, how valuable they are, how accurate they are. We also have been identifying needs across the region in terms of what folks need in order to be able to better adapt with various sectors, organizations, agencies. Our role is as well collaborative training and mentoring with regional organizations. Anybody who's already doing work or is planning to do work, we're not meaning to reinvent the wheel. We partner, collaborate, and work with others and with organizations all across Atlantic Canada. And just a bit about our background. This is an organization that was established through an agreement between the 4 provinces and Environment and Climate Change Canada. It's one of a number of climate services organizations across Canada. There's one in British Columbia, one in the Prairies, Climate West, one in Quebec, Oranos, and we have Climate Atlantic for covering Atlantic Canada. And primarily funded through the federal government with support from the provinces as well. What we do have is we've got a core team of about 5 people, some interns, as well as 1 climate specialist in each of the provinces. That's part of our team, and that you may run into across Atlantic Canada. In Nova Scotia, it's Alex Cadell, and he's embedded within the provincial government. So a little bit about the report, because I was asked specifically to talk about the Canada in a Changing Climate report, the regional perspectives, the Atlantic Provinces chapter that came out in November. And the reason for that is I'm one of the co-authors for this report. And then I also wanted to talk a little bit about the health of Canadians in a Changing Climate report, because that's a report that also was mentioned earlier this morning. Air quality is one of the chapters. But both of those are really providing a baseline as to the impacts on Atlantic Canada in terms of climate change, and also what is being done at this time. For the Atlantic Provinces chapter that you can find by Googling Canada in a Changing Climate Regional Perspectives. This is the report that was under development between 2018 and 2021, was published in November and is online. So it's all online report. There was broad engagement, and the interesting part of this report that I, as co-author, being involved in this from the start, can say that health came up as one of the major areas of focus, even though there was very little really being done in terms of adaptation across the region at the start of this project. As you, and I don't know about Nova Scotia, but New Brunswick had a Health Adapt project coming out that was run for the last 3 years. So those things happened after we actually started with this report, but very little, but still very much an appreciation for the impacts of climate change, both on physical as well as on mental health. Again, the key messages out of that report, I'll just mention those briefly. Obviously, infrastructure as being primarily impacted through flooding and erosion, and we've just seen the most recent ones in the fall. Both Cape Breton as well as Newfoundland, the atmospheric river from BC came over to Atlantic Canada and caused some severe damages. Climate change is exacerbating risks to health and well-being. So this, our chapter, although we knew the health report was in development, we felt very strongly that this was a major point that we wanted to bring across. Indigenous experiences inform adaptation in Atlantic Canada. So there's a lot of initiatives by Indigenous organizations and communities that are happening. Forestry, agriculture, and fisheries are vulnerable to climate change. That would also not be a surprise. And just an example, obviously, the talk about air quality in forest fires. Obviously, forests are impacted not just by fires. In Atlantic Canada, it's primarily likely the shift in species that is the most critical right now, but that doesn't include wildfire risk. And building adaptive capacity will strengthen resilience. So understanding what impacts there are, understanding also the broader impact. So erosion or sea level rise is not just a physical kind of impact, but for many people that are in the line of this kind of hazard, there's a lot associated with stress, with mental health, and with physical health, not by maybe being impacted by sewage treatment facilities that overflow, but just by the feeling of being threatened. So it's a very strong impact that we need to be able to deal with better. So building capacity will improve that. So very briefly, those are the main points that we made, both in terms of that there's risks to health and well-being, as well as that climate change exacerbates already the vulnerabilities in these regions. And I wanted to point out one of the case studies that we have in there. And this is the social vulnerability mapping that was undertaken by Dr. Patricia Manuel from Dalhousie University, where you basically look at where are the most vulnerable populations that are also impacted by climate change, and create overlays to see, well, where are there inequities in terms of being able to respond to certain threats. This is mentioned and highlighted in our Atlantic Canada chapter. The second report that I want to just bring up is the health report, which is to me, it was really an important report that came out, and it has a ton of information. So, and I'm just highlighting a number of them: climate change and health linkages being identified, very clear indication of the inequity in terms of impacts on Indigenous peoples, natural hazards, mental health and well-being, air quality, as was mentioned in the first presentation this morning, but also infectious diseases, water quality, quantity, security, food safety and security, health equity, and then adaptation and health system resiliency. So this is one of the graphs that are in this health report, and I really like, especially the right side of this graph, in terms of sort of very straightforward, what are actually the impacts on air quality. This is pretty straightforward, and I think this really illustrates very well that every single hazard that we have out there, increasing temperatures, increasing precipitation, extreme events, the seasonal pattern changes, they all have an impact, in this case on air quality, but also on many other factors. The headline statements from that report, and I'm glad they weren't mentioned this morning, but I really would recommend you go to the report. It's an excellent report, and it's chock full of information. We know that climate change is already negatively impacting the health of Canadians. So in terms of the fires in British Columbia this last year, the severity of the fires have been associated with climate change. So the increased severity of the fires. So without climate change, those fires would have been different in British Columbia. We also know that health risks will increase as warming continues, and that there's an inequity in terms of who will be affected. Some Canadians will be affected more severely. There's also severe impact of climate change on health systems. We've seen, especially through COVID, that our health facilities are severely impacted when there are events such as COVID happening, and we've suffered all through our health systems being really stressed out. Add heat effects like the heat dome in BC to that one, and you'll have the same impact on our health systems and services. We also know that efforts to prepare for climate change are known to reduce risk and protect health, and the report lays it out really well. Again, this report also specifically notes the impacts on First Nations, Inuit, and Métis people, and how the impacts affect their communities disproportionately. And that is because there is an overlay of already disproportional impacts of challenges in those communities. There's a very strong emphasis on making sure that adaptation actions are inclusive and equitable. And there's also, interestingly, clearly noted that the efforts to reduce greenhouse gas emissions are required to help protect the health of Canadians. So as we've heard this morning, many of the impacts from impacts on air quality and on health are a result, or are going to be worse by the increased greenhouse gas emissions and all the other emissions that are associated with that. And of course, the large and immediate health co-benefits from reducing greenhouse gas emissions are significant, and they can be calculated. So this is a very brief overview, and I intentionally wanted to keep that brief. If you want to get in contact with us, www.climateatlantic.ca, or I've given our general line. So if you want to talk about health, because health is one of our areas of interest, of course. And the second part is I wanted to make sure you've got the website for the Changing Climate Report, where you can find the Atlantic Provinces Report, as well as the Health Canada, as well as the health report and upcoming other reports. So I'd really encourage you to go there. Lots of information there. And that's all for my presentation.